I hope I can honor the mamas and babies who are no longer with us. I had a very healthy pregnancy, and when it came time, I was laboring and dilating normally. When my husband and I got to the hospital, it was like we were on a clock. They kept very close track of the hours. I remember them trying to get me to take an epidural, though it wasn't in my birth plan, interrupting me again and again in the midst of my labor pains, making it seem imperative until finally we relented. I wanted to get onto my hands and knees to push because I could still feel my legs. But every time I tried, 5 of the 10 people in the room, all screaming at me at the top of their lungs, would push me back down. They pinned me down by my feet. I could feel my baby's wet hair because he'd been crowned for hours. One doctor climbed up onto the side of the bed and pushed his forearm into my belly and squeezed downward like my baby was toothpaste. I could still feel the pain days later. Then when my husband and I yelled no to the forceps, they used suction, a plunger, I screamed stop because they were aggressively popping it off of his head again and again, 4 times. Then without warning, one doctor pushed my baby all the way back inside me. I screamed in pain. My body started shaking uncontrollably. Then I lost consciousness. When I woke, I heard my baby cry, and that's our baby. I told my husband, don't let them hurt him, go and get him. And he went. And then I went unconscious again. I remember the warmth that washed over me when I finally got to hold him. I remember 2 nurses in particular in the maternity ward who were kind and gentle with me. He spent 4 days in the NICU. The head pediatric urologist explained to us that it would take time for our baby to urinate on his own because of the traumatic nature of his birth. And our prayers were answered when he did, and we could leave. When we found out we were pregnant again, we vowed to find another way. The first time we met our midwife, I felt like I had met her before. She's a brilliant Black woman with a beautiful smile. Her laugh reminds me of my very own cousin, Valerie. I remember her spending hours with us, visiting in our home, helping my eldest as he was just learning to walk up the stairs on his own. I remember her asking for permission every time she touched my belly and never used a speculum or did an intravaginal check like my OBGYN did at every appointment. We decided to have a home birth VBAC. She gave us choices and was a reservoir of information, never too busy to take a call or answer a text. Last minute, my youngest changed his position and went lateral, so I had to have another C-section, but we had planned so thoroughly that we knew exactly which hospital would respect our team. When I broke down weeping after the anesthesiologist said I would feel nothing from the chest down again, my midwife prayed while she held my feet. My midwife knew my story and prepared me for the time when the trauma of my first birth might return. And she also knows that I believe in prayer. She knew me that well. She suggested that I walk into the OR instead of being put on a gurney in order to feel a sense of agency and autonomy that had been taken from me previously. I got to hold my youngest right after he entered the world, and he latched right away. During postpartum visits with our midwife, she provided lactation support. She checked in on my baby's growth, my physical wellness, my nutrition, my mental and emotional well-being, and how we were adjusting as a family. Both my babies were born via C-section, but the experiences could not have been more diametrically opposed. My eldest and I were not safe. My youngest and I, cared for by a Black midwife, were. The birth of my oldest was my first experience of a kind of institutionalized racism and paternalism that can kill. Throughout my advocacy efforts, I've heard firsthand stories of people in pain being dismissed, threatened, called drug seeking. I've heard stories of the sheriff's department coming to homes in the middle of the night because families refused to take elective tests. I've heard stories of child services being called moments after babies are born because the parents seem unfit. The similarities amongst Black families and the treatment and similar outcomes for Indigenous families and queer families and disabled families and incarcerated birthing people are stunning, and they all have similar root causes. We are being mishandled, ignored, sterilized, and completely disrespected. Many are now scared to start families because they know we're dying in hospitals. There are groups on the ground providing the support that we need, but they need the resources to scale their efforts. We need more Black midwives, Black doulas, culturally competent birth workers, and they need to be supported in their work. They need to be covered by all health plans so that adequate care ceases to be a luxury. We need to demedicalize birth. We need redress with hospitals that fail us so completely. We need racial bias and trauma training, postpartum and lactation support. We need to be heard and believed. All pregnant and birthing people deserve to be treated with loving, patient-centered care. Thank you for this time.